Hello, I'm Rosalie Michaels, and welcome to the Pain Channel, where you can see new episodes each Wednesday at 3 p.m. on your iPhone or Android by entering painchannel.tv into your browser, or, of course, as always, on your PC. And now, let's learn a little bit more about the human body. And today, we're going to be talking about the spine. The human spine is a fantastic engineering achievement. The human spinal column is made up of 33 bones called vertebrae that must support the entire weight of the body and protect an 18-inch spinal cord running down the center. To highlight what a miracle the spine is, when you run 6 miles, that equals 32,000 steps. Each foot strike, you are forcing 5,000 pounds of pressure per square inch. Imagine that force into your feet, ankles, knees, hips, and the spine must dissipate the energy before the pounding jars your brain. Wow, I already feel like I had a workout. Thank you, spine. According to estimates, 80% of Americans will experience low back pain at least once in their lifetime. A small number of patients will develop chronic or degenerative spinal disorders that can be disabling. Men and women are equally affected by lower back pain, and most back pain occurs between the ages of 25 and 60. However, no age is completely immune. Approximately 12 to 26% of children and adolescents suffer from low back pain. Fortunately, most low back pain is acute and will resolve itself in 3 days to 6 weeks with or without treatment. If pain and symptoms persist for longer than 3 months to a year, the condition is considered chronic. The anatomy of the spinal column is extremely well designed to serve many functions. All of the elements of the spinal column and vertebrae serve the purpose of protecting the spinal cord, which provides communication to the brain, mobility, and sensation in the body through the complex interaction of bones, ligaments, and muscle structures of the back and the nerves that surround it. The back is also the powerhouse for the entire body, supporting our trunks and making all of the movements of our head, arms, and legs possible. On today's show, we're going to be talking about spinal cord stimulation with our very special guest, Dr. Jacob Anrani. We asked Dr. Anrani what types of patients get this procedure, and this is what he told us.
These patients have chronic pain, which would be pain of more than 6 months duration, who have failed adequate attempts at non-surgical treatment, and for whom other surgical options have either been tried and failed or may not be deemed to be adequate.
So, Dr. Anrani, what is the success rate for this type of procedure?
It varies according to the diagnosis. In my experience, it seems to work very well for patients who have nerve damage or nerve pain. It also seems to work well in diabetics who have peripheral neuropathy that causes pain and burning in their feet. It also works very well for amputees who have what's called phantom limb pain. We've tried it also in patients with back and leg pain, and although there are a number of successes, it does seem to work best in patients who do have nerve injury or nerve pain.
So how has this procedure improved the options the medical community has with patients?
Well, it allows us to extend help to a wider range of patients who either would have been left with the option of staying on narcotic pain medications for the rest of their lives, or who would have had to try other procedures such as the spinal fusions, which aren't always successful and can sometimes bring their own problems.
Dr. Anrani, can you tell us a little more about the procedure?
Well, this is a model of the spine. And as you can see, the spine is a bunch of blocks made of bone that are stacked on top of each other. In between, there are little cushions or pillows that we call the discs. There's a little tunnel in the back of the spine. The spinal cord runs in that tunnel. the nerves come off the spinal cord and they come out through these little holes and they go down the legs and they go to the skin and the muscles. Now, to put in the stimulator, we have to go to the back of the spine and we have to take off one of these little pieces of bone here so that I can open up the space between the bones. Once that happens, I can insert the stimulator that looks like this. And I can slide it into that tunnel and it'll sit on top of the spinal cord. Then I tie the wires down to the next bone that remains so that the stimulator can't move within the spinal canal. Then we make another incision above the patient's hip in the back, and we make a little pocket in the fatty layer for the generator or battery. And then I run the wires from the stimulator under the skin from the midline incision to the pocket that I've made for the battery, and we insert the ends of the wires into the battery, and then we put the battery and the wires into the little pocket we've made so that everything's implanted in under the skin and nothing will be exposed.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
Now it's trivia time. So which superhero's chronic back pain almost prevented him from starring in the film's sequel? Tell you what, come back at the end of the show and I'll give you the answer. And now, let's go inside the OR with Dr. Inrani and watch as he performs the procedure.
The patient is first brought to the preoperative area. The patient may be given some medications to help her relax. Then we take the patient back to the operating room. We then clean and prepare the skin on her back and above her hip with an antiseptic solution to prevent infection. Then we make the incision above the left hip and we create a pocket in the fatty layer under the skin, and this will be for the battery. Then we make an incision over the spine in the midline and we cut through the skin and the fatty tissue. Then we have to peel the muscle off of the bone. Then we have to remove a small portion of the bone in the back to expose the space between the bones. Now we are using a special instrument to remove the ligament between the bones, and this will open the space between the bones and give us access to the spinal canal. Now you can see us inserting the spinal cord stimulator into that opening, and we are sliding it into the spinal canal where it will sit above the spinal cord. Now you can see us passing some sutures through the next bone below, and these sutures are used to tie down the wires so that the stimulator can't move. Now you can see us passing a special instrument called a tunneler from the pocket for the battery to the incision in the midline. And you can see we are removing the central metal portion, and this leaves that long plastic tube under the skin. Now you can see us passing the wires through that tube, and that will lead the wires under the skin from the midline incision to the battery site. Now we're removing the plastic tube, and you can see that this leaves the wires under the skin. Now you can see us placing the wires into the battery, and the wires are being secured within the battery with a small torque wrench. Now we are creating a little loop of wire behind the battery, and we are placing the battery into the pocket. And now we are testing the system to make sure that the stimulator is making good contact inside the battery. Now we are inserting the battery and the wire into the pocket, and now we are closing both incisions.
Right, that was incredible. Okay, we all want to know, how did the surgery go, Dr. Anrani?
The procedure went very well. It went without any complications. It was very smooth, and the patient recovered nicely and went home the next day. The spinal cord stimulator is a relatively new technology that was developed for patients with chronic pain for whom other surgical procedures may not be felt to be effective.
That was great. Thank you, Dr. Anrani, for joining us today and providing such great, valuable information.
Thank you, Rosalie. I hope that this session was informative and that I've been able to answer all of your questions.
For someone who died prematurely, President John Fitzgerald Kennedy suffered from a large number of ailments and other conditions. People can only speculate about the source of his well-publicized back pain. Some attribute it to a great deal of competitive contact sports during childhood, where his slight frame put him at a great physical disadvantage. Others attribute it, at least in part, to injuries he may have incurred when his PT boat was sunk during World War II. Still, others say it could be side effects from steroidal treatments he received in his 20s for colitis. At the time, steroids weren't nearly as well understood as they are now. So now it's time to give you the answer to the trivia question we asked you earlier in the show. So which superhero's chronic back pain almost prevented him from filming the sequel? It was Tobey Maguire in Spider-Man. That's all we have time for today's show, but we'll see you next Wednesday at 3 p.m. for another episode on the Pain Channel.